ready. So I am Professor Shyamapada Mandal. I am going to present a paper which is entitled Therapeutics of Cancer in COVID-19 Therapy, the Insights. Because of COVID-19 pandemic, we are staying in home still. It is just 1 year approaching, and we are not going for our work into our research laboratory, and we are doing research work as well as academic performance from home, staying home. And this is a review work on COVID-19 therapy. We are just trying to show that the cancer drugs can be repurposed for COVID-19 therapy since COVID-19 drugs are not present. So before going to the main discussion, we have to discuss about the pandemic. That means the current situation of the pandemic and how the virus, that means SARS-CoV-2, as well as the disease is caused and the virus is transmitted, and what is the relationship between cancer and COVID-19 in terms of immunopathology, and so that we can repurpose the drug of cancer for COVID-19 in this situation, and cancer drug treatment with other drug repurposing. So this is the global scenario of COVID-19. Here we are seeing that more than 67 million cases have been reported to the World Health Organization, and death due to the disease has been caused is 1.5, more than 1.5 million. And the current situation is here presented here, and the reports are available from World Health Organization. And similarly, this is the death situation. Here, this is the total number of cases and the number of deaths I have already seen, so shown and represented. And this is the situation, global situation of death due to COVID during the first 1 year almost. And the current situation today, we have seen that more than 10,000 patients have been died. So the situation is very alarming, and this is starting from last year, December, up to November this year. So this is the trend of increasing number of COVID-19 patients, and this is death starting from the same time almost up to the November 30 here I have represented. So the death number this is 1.5 million, and the case is 67.7 million almost, and both the situation, that means the COVID-19 cases and COVID-19 deaths, are increasing still. And if we consider the WHO regions such as Americas, Europe, Southeast Asia, Eastern Mediterranean, Africa, and Western Pacific, these 6 regions are found or located in our World Health Organization reports, and there are a number of deaths in the first picture, and in the below the death situations are represented. We are seeing that in Americas the case number as well as the death number is the highest. Here the case is 28.8 more than million, in Europe 20.86, Southeast Asia 11.195 million, Eastern Mediterranean 4.378 million, in Africa 1.5 million, and in Western Pacific 31,000 more or less the cases, and the death case situation is in America 756,000, in Europe 462,000, in Southeast Asia 170,000, and Eastern Mediterranean 109,000, and Africa 34,000, and Western Pacific 17,000 only. So the situation is increasing, we are already seeing. And here are the 6 important countries: United States of America, India, Brazil, Russia, France, and Italy. So 6 countries, we are seeing that among 6 countries, among other countries, United States is located on the top with this number of cases. That means 14.75 million, India 9.7 million, Brazil 6.6 million, Russia 2.54 million, France 2.269, and Italy 1.757 million cases. And here the pattern series, United States, the increasing, still the situation is increasing and alarming. And India, this is also alarming, but the situation is somewhat better at present condition compared to the past condition. See the graph, the first that was increasing and then decreasing, and now it is almost stable. But in Brazil, the situation is undulating, just increasing and decreasing number of cases in daily cases are seen. And the other, in Russia also, the situation is not good. This is the graph showing the increasing condition of cases of COVID-19. Here, France is better, and this is now decreasing. In Italy, also decreasing in situation. And the deaths, and daily deaths, top is the United States of America with 281,000, Brazil 177,000, India 141,000, Mexico 110,000, United Kingdom 62,000, in Italy 61,000. And the situation is not good, except Mexico. Here the situation is just towards the baseline. India also just towards the baseline, but above the baseline it will take some time also to become good in situation. So this is the background of the disease, that means the COVID-19 pandemic, and we know that COVID-19 disease is a viral disease, and the disease causing agent is a virus which is known as SARS-CoV-2. And this structure is presented here, and the main structural proteins are responsible for the transmission as well disease causing. These proteins are spike protein, envelope protein, membrane protein, as well as nucleocapsid. And probably regarding its origin, the virus, this SARS-CoV-2 virus has been originated from the bat, and then hypothetically, not just, there are some reports, and maybe the virus has been transmitted from bat to man, and in current situation, man to man, that means person to person, spread is possible. And in current situation, we are seeing that this is the droplets, as well as the particles of large size and small size. These are responsible for transmission of viral laden particles from one person to another person due to speaking or sneezing or coughing or singing. And when persons gather, there are high chances, and when the persons do not use face masks, then the spread of the viral particles may be seen from one person to another through these droplets or aerosols. Aerosols are smaller in size, and that can be invade into the very deep into the lung alveoli, and larger drops may cause translocated into the upper respiratory tract, and so the situation is different in disease severity. When the droplets are causing the disease or infection in the upper respiratory tract, the situation is mild or no symptoms, and when it goes into the deep with a smaller size, that means aerosols, the lung alveoli cause cytokine storm or inflammation, and show that the situation is like this with COVID. And the clinical spectrum is divided into asymptomatic, mild or moderate, severe, and critical. Asymptomatic, COVID nucleic acid test positive without any clinical symptoms and signs, and the chest imaging is normal. Symptoms of acute upper respiratory tract are seen in mild cases. Also fever, fatigue, myalgia, cough, sore throat, runny nose are visible, and sneezing. Moderate or pneumonia, that means fever and cough is present, as well as hypoxemic. And chest CT scan can find with lesion, that means rupture in the lung. And severe is pneumonia with hypoxemia, oxygen saturation is less than 90%, and critical is acute respiratory distress syndrome, ARDS. This is very dangerous for some persons of old ages or some conditions such as heart disease, hypertensive person, as well as cancer, because some cancer symptoms may be seen in COVID symptoms in relation to immunopathology, and that means cytokine storms are seen in both cases. So we are going to discuss about the applicability or reversibility of cancer drug in COVID-19 therapy therapy in absence of COVID-19 drugs or vaccines. So, encephalopathy may be seen, myocardial injury, heart failure, coagulation dysfunction, and acute kidney disease are seen. And all these critical symptoms may be similar to the cancer. And these are the common symptoms: fever, cough, soreness of breath. And rare symptoms, some are headache, hyposmia and hypoglycemia, sore throat, rhinorrhea, muscle pain, as well as diarrhea. And the complication may be seen with ARDS, that means acute respiratory distress syndrome, sepsis, that means septic shock, and multiple organ failure. And the secondary infection, multiple organs, maybe heart, kidney, along with the lungs or other organs. And secondary infection with the virus, other virus or such as influenza or fungal or bacterial infection may be seen. And immunopathology of COVID condition, here we are seeing the lymphopenia is the main cause of ARDS. That means in critical condition, the critical presence. Here, all types of lymphocyte, CD8, CD4 lymphocyte T cells are decreasing in number, and NK cell, natural killer cell, or B lymphocyte are decreased. Here we are seeing that in such situation, interleukin-2, tumor necrosis factor, and interferon gamma are increased, and on CD4 lymphocyte, such CD69, 38, 44, these are highly expressed. And here, that means here T cell lymphocyte activation occurs. And here lymphocyte dysfunction have been seen. T cell exhaustion you seen. This is PD1 and NKG2A and TIM, and these proteins are, these receptors are expressed, highly expressed, as well as natural killer cell exhaustion also occur due to the expression of NKG2A cells. And here we are seeing that neutrophil number are increased while the monocyte, eosinophil, and basophil are decreased. That means abnormalities of granulocyte and monocytes are seen in case of COVID-19 patient. That means SARS-CoV-2 infection. As well as we are seeing that the main feature of critical symptom is the cytokine storms. Here, a large number of cytokines are released, and of which interleukin 1 beta, interleukin 6, interleukin 10 are very important. And in this phase, we are seeing that the IgG, that means increased antibodies, IgG are increased, as well as the total count of antibodies are increased due to the SARS-CoV-2 infection. And the potential mechanism of SARS-CoV-2 induced immunopathology includes the potential mechanism depletion and exhaustion of lymphocyte. Lymphopenia may lead to infection with microbe, further promoting the activation and recruitment of neutrophil in the blood. The potential mechanism of cytokine storm induction, disease progression, and poor outcome of patients with COVID-19. Here we have to explain here the spike protein. Through spike protein, the virus is get attached to SCE, angiotensin converting enzyme of T cell lymphocyte. This is a host cell, and then after get entry, the impairment of the T cell occur. As a result, this depletion of T cell occurs and exhaustion also occurs, and by releasing tumor necrosis factor, interleukin 6 and interleukin 10. And as well as the same time, damage to the lymphatic organs such as spleen as well as lymph node is seen, and so that viral replication is increased and lymphopenia occurs. And due to lactic acid production in T cell, the T cell impairment and dysfunction is seen. And here also seeing that due to such situation, the secondary infection with other microbes such as fungus and bacteria that may be occurring in COVID-19 patient that we have already discussed are seen. And that's why a large number of neutrophils are recruited in that place, causing the activation and recruitment of neutrophils for further cytokine release. And here we are seeing that CD4 plus cell is converted into T helper cell 1 that increase GMCS molecules and induce CD14 and CD16 cells to promote release of IL-6, that means interleukin 6. And at the same time, monocyte secrete CD4, CD14 and interleukin 1 beta So the number of interleukin 1 beta is increased. Here the cytokine storm is seen also because of the recruitment of neutrophil, monocyte, as well as macrophages. Here we are seeing that interleukin 1, interleukin 6 are increased. And here, when antibody neutralize the virus, this is the virus. Through the interaction of FC and FC receptor, and then the entry of the virus is enhanced, and this is experimentally proved. And so viral entry occurs, and the disease progression and poor outcome is, that means there is no drug treatment is not possible, and the outcome of the disease is towards critical. So this is all about the potential mechanism of SARS-CoV-2 induced immunopathology, and this is clinical implication. The SARS-CoV-2 patients with COVID-19 and presenting with lymphopenia and more prone to infection with microbe that we have discussed here. We will also explain, which leads to disease progression and increased severity. The clinical implication, the effect of lymphopenia on microbiota infection. We know the interesting feature is the lymphopenia in COVID-19 patient. Here, seeing that T cell as well as NK cell are decreasing in number, lymphopenia causes. That means, and due to this, opportunistic pathogens, opportunistic microorganisms, virus or fungus or bacteria are secondarily infected. So the inflammation is increased and microbial infection is increased along the same time. And here we are seeing that the effect of elevated cytokine production on severe syndromes. That means the same we have already told, interleukin 6, interleukin 10, interleukin 1 beta, etc. This is cytokine storm, and these causes multiple organ dysfunction, such as in lungs, ARDS, respiratory failure, ALT, AST, and gamma GT are increased, so the liver damage occurs, and urea creatine cause the kidney injury as well as heart failure occurs due to creatine kinase increase and lactate dehydrogenase enzyme increment. And here, so that we have already told that there is no drug or vaccine in case 19 treatment. So we have published a paper in Research Square, a reprint. We have mentioned some drugs which are represented here. That means some targetable points are present here. That means the drugs are acting in various targets, and the names are represented here. So the repurposing of various kinds of drugs, that may be antiviral or antibacterial or antiparasitic or or immunomodulating agent or anti-cancer agents, are now utilizing in COVID patient for their treatment. So we have now considered that the cancer drug may be most suitable for the treatment of COVID-19 patient due to the similarity of critical case symptoms of COVID-19 patient as well as cancer patients. Here are some repurposable drugs, and the targets, different targets are found in COVID-19 patient virally as well as in relation to host. These are RNA-dependent RNA polymerase. This causes replication of viral RNA, and some drugs, remdesivir, ribavirin, and favipiravir are important that use the target RDRP. PL-PRO, that means papain-like pro. This is another target or receptor of drug, a protease for the conversion of viral polyprotein into functional enzyme. Lopinavir, protease inhibitors that may inhibit the viral protease 3CL-PRO and darunavir are also suitable for this target. And main 3CL-PRO, that means main proteases, a protease for the conversion of viral polyprotein into functional protein. Lopinavir also suitable for this target. And S protein and TMP are SS2, viral surface protein for binding of host cell. We have already discussed. Angiotensin converting enzyme, TMP RSS2, that help in their binding. That means S protein and SU2 binding. This is part of host cell. This is part of viral particle. A host cell produced protease that primers S protein to facilitate the binding of ACE2. Arbidol is the main drug as well as canostat that may be suitable for this or with this part, that is target. And angiotensin converting enzyme will also target a viral receptor protein on the host cell which binds to viral protein. Chloroquine and hydroxychloroquine may be responsible for the prevention of entry of SARS-CoV-2 virus into the cell. And here are the main therapeutic stages. The stages depend on the enhancing of lymphocyte as well as the inhibiting inflammation, because we have seen inflammation is the a very important critical symptom of COVID-19 patient. Here therapeutic stages are NK cell based therapy, immunomodulator based, as well as conversion plasma. Here agent recruited are NK cells, interferon alpha, and 2A, 2B, thymosin and conversion plasma itself are used. And here are the function. Antiviral stimulates the innate antiviral response. Antibodies from conversion plasma inhibit viremia. That means viral replication is inhibited. Here MSC based therapy. Here T regulatory cell based as well as blood purification, blockade of interleukin 6. Here MSC cells are recruited, T regulatory cells, blood purification, tocilizumab and sarilumab. These are two monoclonal antibodies. These are recruited for inhibition of inflammation, and target is interleukin 6 receptor, blocks anti-human interleukin 6 receptor. And some anti-inflammatory agents are vericitinib, fedratinib, ruxolitinib. These are inhibit JAK genus associated kinase signaling to decrease cytokine level, and this drug inhibits virus replication, attenuates cytokine storm. This is DHODH inhibitors. And drugs, some drugs, rapamycin derivatives, chloroquine derivatives, SI-113, tocilizumab, sarilumab, imapazumab plus enacarina, monalizumab, BCG. This is TB vaccine, and lopinavir plus ritonavir in combination, ribavirin and remdesivir are used, and their mechanism of action are summarized here that we have already that we will discuss later on here also. And here the approved drug that may be used in cancer patient or the patients with cancer symptoms. And the most important are tocilizumab and citolizumab. These are interleukins and IL-6 receptor inhibitor. Actually, in cancer, Castleman disease and cytokine release syndrome, in this case, are utilized. Interleukin 2, T regulatory expansion and activation, the causes, and the cancer drug for melanoma and renal cancer. Interferons are immunomodulator agents, and these are actually utilized for hairy cell leukemia, melanoma, follicular lymphoma. Immunomodulators are those such as examples are thalidomide, lenalidomide, immunomodulatory and anti-angiogenic activity. Are showing by this immunomodulator agent and actually discovered for multiple myeloma. And another drug is anticoagulant type, enoxaparin, that bind to antithrombin and to irreversibly inactivate clotting factor XA. That means abdominal surgery and thrombosis occurs due to the prevention, in order to prevent the blood loss, and this substance is used. And antivascular endothelial growth factor is also used, which is also cancer drug, and the drug name is bevacizumab. This is actually monoclonal antibody, actually given for colorectal cancer patient, non-squamous, non-small cell lung cancer patient, glioblastoma, and renal cell cancer patient. And corticosteroids includes prednisolone, dexamethasone. These two are greatly now using in current situation for ARDR patients, that means critical patient. These are actually anti-inflammatory substances and actually discovered for lymphomas as well as leukomas patient. And checkpoint inhibitors are nivolumab and pembrolizumab. These are the monoclonal antibody, and especially given for melanoma type of cancer, squamous cell cancer, as well as Hodgkin's lymphoma. And these are the checkpoint inhibitors. Kinase inhibitors include ruxolitinib and imatinib. These are actually BCL, AVL, tyrosine kinase inhibitors, and used for myelofibrosis patients and the as well as acute lymphoblastic patients. Nuclear export inhibitor includes selinexor. It binds to export in 1 multiple myeloma. This is the cancer type against which this drug is known to be used. And here are some target points for the anti-cancer drug. The tocilizumab and sarilumab, these are monoclonal antibody acting against IL-6 IL-6 receptor, and these are the cytokines against which are used in emapalumab and ripamycin, chloroquine, and BCG vaccine. Here we are seeing monalizumab is used against the receptor of NK cell, and here chloroquine is preventing the entry of virus into the host cell, and ripamycin, chloroquine, SI113 are responsible for their assemblage and viral RNA replication as well as viral protein assemblage. Against these points, ribavirin, lopinavir plus ritonavir are utilized. So this is all about the target points for cancer drug activity in COVID-19 patients. Here, possible mechanism of anti-tumor therapies being studied in clinical trials for COVID-19 patients. Here we are seeing that BCG and imatinib that we have already discussed. These are responsible for the inhibition of entry of the virus. Here anti-CCR5, anti-VEGE, BTK and JAK inhibitors. These two drugs, etoposide and selinexor, we have already discussed, and this causes immune cell recruitment, vascularity, cytokine release, and immune cell proliferation. When these occur, such drugs are very important for application. And type 2 interferons are also applied to inhibit the cytokine storm, and another some such drugs include anti-interleukin 6, anti-interleukin 1, anti-PD1, and interferons also. Thalidomide we have already discussed. That means here we are seeing that alternating ability of SARS-CoV-2 to infect either through vaccination and inhibition, altering the ability of host cell to infected through activation of interferon, blocking recruitment of immune cell to the lung, altering vascular permeability, inhibiting cell proliferation, directing the immune response, and controlling inflammation. And here the drug types with their possible targets are represented here, and these are mentioned here. I am not going to read out this again because we have already discussed here. And some important drugs to be summarized here are inhibition of viral multiplication. And the drug is carmofure. Actually, this is cancer drug used against glioblastoma and pediatric brain tumors and SARS-CoV-2 main protease inhibitor. And this carfilzomib also the same type of drug acting against SARS-CoV-2 by inhibiting main protease. And actually this drug is responsible for the treatment of myeloma patients. And here the inhibitors of endocytosis and or TMP are SS2 mediated cell entry. That cell entry is inhibited by tormifin as well as imatinib. And these are derived actually for the patient of cancer. We are seeing that the anti-estrogen receptor drug, selective modulation of estrogen receptor used in the endocrine therapy of breast cancer, and prophylaxis of COVID-19, that means SARS-CoV-2 infection, entry is prevented. And this drug, tyrosine kinase inhibitor, chronic myeloid leukemia and gastrointestinal stromal tumors are treated with this drug. And this drug prevent the progression to severe disease in patient more than 70 years of age with COVID-19 patient. And here the inhibition of viral RNA replication, the main important drugs include zolpidem and plitidepsin. Actually, these are small molecule inhibiting the eukaryotic inhibition factor, that means EIF4A, and RNA helicase that stimulates oncogene linked to tumor growth, cell survival as well as metastasis. That means when the cancer type is tumor type of cancer, the cell is rapidly dividing, surviving as well as transferring from one organ to another organ. This zolpidem is used in cancer. And in case of COVID-19, prevents SARS-CoV-2 infection and propagation inside the cell if entry occurs in earlier stage of infection. And this drug, actually cancer drug, derived from a microorganism, Epididium albicans. Myeloma cancer treatment is done with this drug, block EFIA, a protein in human cell that is required for SARS-CoV-2 infection. And dactinomycin, this is a microorganism, Streptomyces parvulus bacterium. From this microorganism, dactinomycin has been discovered. And this is an anti-neoplastic drug, and now in combination with sirolimus, dactinomycin is very important for COVID-19 patient treatment because these combinations show synergistic action. Here, the inhibition of upregulation of immune checkpoints. Some such drugs are camarylizumab, nivolumab, and pembrolizumab. These all are monoclonal antibodies used against cancer therapy for different types of cancers. Some are osteocarcinoma and relapsed or refractory classical Hodgkin's lymphoma, and here humanized and fully human anti-PD-1, immunoglobulin G4 and monoclonal antibodies, advanced or metastatic cancer patient with COVID-19 can be treated with this monoclonal antibody. And in advanced or metastatic cancer patient, these are derived in COVID-19 patient. That means cancer patient with COVID-19. And this third monoclonal antibody are used in solid cancer treatment, particularly the melanoma and COVID-19 associated with pneumonia and ARDS inhibition. This is responsible for the inhibition of ARDS of COVID-19 patient. Inhibition of cytokine storm associated dysfunction immune response. So we are seeing this bevacizumab, ruxolitinib, and lorenlimab, and these are very important. And we have already discussed about bevacizumab and ruxolitinib. This is genus kinase inhibitor, and this is anti-angiogenic, bevacizumab. And vascular permeability as well as the ARDS is decreased, so that the critical COVID-19 patient may be may get relieved with these drugs. And here we are seeing that such cancer drug may be repassed for COVID-19 treatment, but there are some precaution because of their side effects. That means when we apply for treatment of COVID-19 patient with the cancer drug, the side effects like activation of latent infection may occur, promotion of autoimmunity, liver toxicity, hypertension, immune suppression, increased risks of clotting, as well as toxicity to develop fetus and placenta. Here, latent infection, genus associated kinase inhibitors and anti-interleukin 6. These drugs are responsible for causing latent infection. And some such drugs, interleukin 6, interferons, imatinib, methotrexate, side. These cancer drugs, when applied in COVID-19 patient, liver toxicity may be seen. Clotting also occurs due to the application of JAK inhibitor, genus associated kinase inhibitors, and contraindicated in pregnancy also seen anti-VEGFR, imatinib, and thalidomide. And autoimmune interference immune checkpoints, hypertension may be caused due to VEGFR and anti-CCRF. Immune suppression, JAK inhibitor, interferon, imatinib, BTK inhibitor, selinexor, etoposide, and methotrexate, as well as thalidomide, and these are responsible for causing immune suppression. That means immunity may be suppressed in COVID-19 patient and in clinical patient, so may suffer greatly. And these types of anti-cancer agents are utilized in COVID patient without any clinical trials. So concluding remarks are, and that means the COVID-19 pandemic, we are seeing that this is running for almost 1 year, and that means this is ongoing, and this is very dangerous, causing in our society and in the globe also. And no drugs still are discovered, and vaccine is not found for the treatment of the COVID-19 disease. So we are depending on the repurposing of existing drugs that we have discussed, and cancer therapeutics may be thus may thus be repurposed in COVID-19 patient treatment as well as cancer therapies in COVID-19. Safety aspect may be prioritized before the application of cancer therapy in COVID-19 patient treatment. And these are the publication in relation to COVID-19, and 10 papers we have published already.